super excited. We have Brenda Generali today. Brenda is a human iridologist. She is world renowned. She is one of the top instructors globally for iridology, and then she does private sessions. She assessed my eyes the other day. Fun story is I've been going to Auburn, California for IV ozone, and I asked the functional medicine doctor, do you know any iridologists that happen to be in town? She goes, there's somebody, and I hear she's really good. I'm like, okay. So my truck breaks down. I have to take it over to the Dodge dealership in Auburn. And as I'm sitting in the waiting room, I'm like, look where she is. And it was you. And I was shocked because I've known your joyful living. Cheyenne took your class and you are famous. So I was and I was like, what the heck? She's 1 mile from the Dodge dealership. And so I reached out to you. And then when I picked my truck had to stay for a week. And when I picked it back up, I got to have an appointment with you. So fun way to break down, I guess you could say it. If you're
Yeah,
gonna break down, it might as well be fun.
yeah.
Yeah.
I
So
always figured things happen for a reason.
absolutely. Thank you for being live with us today. You guys, when she assessed my eyes, it was really amazing because I had done blood work the month before, extensive blood work, and everything she read matched the blood work. I was like, "Ugh, if I didn't do that blood work, I probably wouldn't have been as impressed. But because I already had the blood work and it totally matched, I was blown away, absolutely blown away. And it's very different than animals. Yeah. So Brenda, I know you have some a presentation for us, and I can't wait to hear what you have to share. But I'm just can we ask some questions? We can ask questions at the end, but I know you're into sclera reading, which none of us know anything about.
Oh, sure. Yes, the sclerology. Yeah, it's the study of the white part of the eye. And so we read the little blood vessels that are in the white part of the eye. There's a lot of colors that show up in there: yellow, pink, red, gray can show up in there, black can show up in there, and all the different colors mean different things. All the little lines, the emotional lines, the physical lines, virus lines, trauma lines. We can see all kinds of things in the sclera. The sclera shows you what's going on now. So as your body changes, and so I have to tell you, it's really funny that you say I do human iridology because that's like all I've ever done. I mean, I have looked at dogs. I do have some dog clients and some cat clients, and and I know how to do some of that and have helped them. But it was just funny when you said that I do human iridology because that's what I've always done, right?
Yeah, and none
But
of us do. You know, I do dogs, cats, and horses. Cheyenne even does some cattle and sheep and goats, and I've done a couple birds before. The birds seem to be really exact to the Bernard Jensen eye grid.
hmm,
Yeah, I was really amazed.
wow.
Yeah, I was
So do
like,
you have a chart? Do you have actually a chart for bird iridology?
I just use Bernard's.
Because I'm next month I'm supposed to go out to Idaho and I'm going to be seeing one of my students out there and she raises birds.
Oh my
And
God.
and she's in my iridology class, so I wonder if she'd be interested in, not that she needs anything else to learn how to do, but that might be something, since she raises birds, she might be interested in something like that.
Yeah, the face marker is the beak.
Oh wow.
Yeah. And so we had a bird expert, the botanical bird lady on as a guest, and she showed some iris photos. She didn't know iridology. And I was like, oh, does your bird have a beak problem? She's like, how would you know that? Yeah.
Oh, that's neat. Yeah.
Yeah. So
So
now you get to do this.
yeah, so well, we use the face. We do the eyes, we look at the iris, we look at the sclera. I've had several people come in and do some trainings how to read the face, the ears, That's amazing because you can just sit there and look at somebody's face and you know all about them. I mean, I can tell you all kinds of things just looking at you right now.
That's terrifying. Don't look at me.
About your personality, about your body, about how you see the world. And it only takes a second. You can tell all kinds of things about a person, just your smile, your lips, your nose, I mean, your eyebrows, all kinds of things you can see from the face.
You're freaking me out. Can you do the same with dogs, cats, horses?
Well, through the eyes. I don't know anything about reading a dog's face, other than I know that they usually end up looking like their owners. So, you know,
I
but
always try to get a dog that has more wrinkles than me. Yeah. So I look younger.
I know that you can tell a lot about personality about their dog, and looking at their face. You can kind of tell their kindness, or if they're more serious. Just like with humans, you can tell a lot about that. You wear a lot of your feelings and your emotions on your face. So,
I believe that. All right. Now that I'm freaked out about my face,
well, next time you come, I'll tell you. I'll show you some of the things about your face. It's really cool.
it's pretty interesting. It's
It
pretty
really is.
fascinating, really. Honestly, the body leaves clues.
Yeah,
Absolutely. It's so jaw-dropping to me. It's so like divine in my mind. It's just
yeah,
a perfect thing. So
yeah.
we
Just
have a
like,
lot of our clinical, so I'm teaching a clinical companion animal iridology course right now. We have a lot of our clinical students online right now watching too. So that's exciting for all of us to learn more because um, animals' irises change so much more than humans, and none of we recognize the sclera when it's red or not, but we're not necessarily reading the sclera at all. We're just
okay.
acknowledging like it's weird color or it's inflamed or it happens to be like pointing to the lung area or something like that.
Well, for us, it really complements the eyes, the iridology. So, we can look at the iris and see the genetic tendencies from the iris, and then we can look at the sclera to see if something's going on now, and what it could be depending on how the vessel is moving through the sclera, how it's moving, where it's going, what shape it is, so on.
It's so incredible.
And healing too. We could see healing through the sclera.
Well, and
So,
that's what we don't, our dogs don't have that big a constitutional, like you guys have the brown eyes, the blue eyes, like all these different constitutional eye colors, and dogs don't. Like it's shades of brown and blue, and maybe you'll see a green-eyed dog every once in a while. And then in cats, you have all these bright, bright, bright colors, and you'll rarely ever see a dark eye, but you'll see green eyes and yellow eyes and blue eyes, but very rarely like a brown-eyed cat. So yeah, it's so different in those respects. And the cats mark totally different than dogs. Same eye grid, but they don't have like that collarette rim like dogs do.
hmm. If somebody comes in your office and they have golden eyes, a person,
A
if a
person.
person comes in and they have golden eyes and they look like a cat, that's a mixed eye. And so, all you have to do is look because you can see it from far away if they have kind of that golden eye. You know everything about them right there. Just
That's
that
amazing.
boom. Yeah.
That's so incredible.
Yeah.
Gosh.
So, the iridology is really great. You were talking about how you're freaking out. I mean, you can really know a lot about a person really quickly with iridology. And
So Brenda, because I'm single, I could like look into my date's eyes and
oh no, Rochelle's laughing because we were just talking about this in class today. I'm never going to tell you to date somebody or not date somebody or marry them or not marry them.
off their iridology, I'll be like, oh, how's that kidney of yours?
No, 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 I won't go there. Oh my God,
and
that's
and you
funny, huh,
guys see
Rochelle?
the and you guys see the emotional aspect we just see like stress lines, nervous stress, but we don't get into the psyche so much. You actually do.
Right. Well, there's the physical iridology and the emotional iridology. And, I was going to talk, I'll talk a little bit about both of those. And they're very different. They're very different in the way that we look at the eyes. And now, so many people are finally understanding the emotion and how it, affects the body. And so more and more people are like, oh, wow, that makes sense. Right.
Right.
So
And then
where we,
one more thing, Mercedes was always talking about heavy metal detection, but she never really tacked it down in the dog and cat or horses. But you guys can actually see heavy metal toxicity, right?
we can see a sign, yeah, around the pupil that can be possibly, maybe heavy metal, but I always do further testing to confirm.
Oh, that's a good idea. Why not?
Mhm. Yeah, I
And you
usually
have
do.
you do it through the Zyto or do you do like hair mineral or blood? All of
I
it.
do. I'll do all of the above. I mean, I'll do a hair analysis if somebody wants to do a hair analysis. That'll show us heavy metals. I'll run the Zyto. That'll show us. Zyto won't tell us what the heavy metals are. It'll tell us if you have them, and then usually I'll run a hair analysis, and then we'll know more, you know, and this, so on. Yeah.
Excellent. We'll share away.
Okay. All right. Wasn't that funny, Rochelle? That was hilarious, huh? I
Yeah,
was just
every
talking
time
about that.
I go to the movies on the big screen, I can't help myself looking at actors' eyes because you know everything they're up to.
Oh, yeah, I'm notorious for taking pictures of people's eyes when I'm sitting in my living room watching TV. I just shared somebody. Somebody that was a talking head. He had one blue eye, one mixed eye, and so I went up to the TV and I took the pictures and I shared it in the class. And I mean, that's somebody now, So
That
yeah, no, yeah. I see eyes everywhere.
yeah,
Okay.
I always tell everyone you will never look the same after this.
Yeah. No, and Rochelle in class today, I'm going to talk about you because I can see you, Rochelle. She was talking about how now every time she sees a picture, she looks at the pupil and she can see the pupil flattenings. That's the other thing we do in iridology is we look at the pupils and how large the pupils are, small the pupils are, the shapes of the pupils, the flattenings of the pupils. It's all part of it. And so, once you learn some of these things, it's like you just see them everywhere. You just see the stuff everywhere. Okay, well, this is my talk. It's Introduction to Physical and Emotional Iridology. There's all my information on that page. I'm a naturopath. I'm a certified comprehensive iridologist and instructor, levels 1, 2, 3. I own Joyful Living Services. I started my business in 1987, and I'm a sanctioned school with IPA, and I got an award last year, Professor O'Brien Education Mentoring Award, which is really cool. There's my website if you want to learn more, my email, and my phone numbers if you want to talk to me. So I'm available. I'm pretty available most of the time. Text works really well with my cell if you have questions, comments, anything. So first thing I just want to say is thank you for inviting me to be a speaker. I was like, you asked me to be speaker. I'm like, yeah, I'm always willing to speak. And so, this is great. It gives me another chance to share my love, which is, iridology. I've uh, I've loved iridology for many years. And this is a picture that I have of a client of mine. And you don't usually see pictures like this of eyes. This is amazing. It almost looks like a world. It almost kind of looks like it's going around here in circles. So this is a lot about me here. This is an old picture of me. Dr. Bernard Jensen, he was the father of iridology here in the United States, and I volunteered years ago for one of his symposiums and took pictures of everybody that walked in and helped him with that. So the way I got into iridology is different than the way most people get into iridology. Most people get in because they want to start a business or they want to add it to their business. We have lots of people that already have their businesses, massage therapists. We have all kinds of people that are doing iridology that already have their business, naturopaths. We have many people in the medical field that are already involved with their businesses and they want to add another tool. So for me, it was because I was sick and I had a friend. I was dating a guy who had a friend whose girlfriend's name was Rochelle. It's like I feel like I came full circle with her in my class. And she had endometriosis and she was getting good results with this iridologist in the Bay Area. And I was having all kinds of digestive problems. I was breaking out in hives all over my body. I was in all kinds of pain in my back and couldn't eat hardly anything anymore. And I was talking to her and she says, "Why don't you go see my iridologist?" So I did, and he helped me, you know, he helped me. I went to the doctor and the doctor said, "Take Rolaids and drink milk." Oh my God. And that was the absolute worst thing for me because I had IBS. And I went to Chris and he's actually, even after all these years, he's still practicing. He's up in Washington. And so he's still seeing clients after all these years. He helped me. And then I sent some friends to him. He helped them. And one day out of the blue, I called him and I said, "How do I learn more about this?" I was curious. And he said, "Call down at Dr. Jensen's. He's down Escondido and he teaches classes." It just happened, you know how I say everything happens for a reason. It just so happened he was teaching a class like the next month. And I signed up for his beginning class and I went down and studied at his Hidden Valley Ranch down there. And I loved it. And I stayed for the advanced class and I got certified. And the following week, they started sending me clients, and I didn't know what I was doing. So that was great, and that's it. I mean, that's how I got into iridology, and I've just learned from there ever since. So my mission has always been to help improve health of others and to help people. And I got involved with IPA 2018, and you can see everything there. I just got certified as a menopause specialist. I am a genomic iridologist, so I do work with MTHFR. That's really important. And I work with the California Naturopathic Association to help naturopaths and to pass laws and so on. So there's some of the things about me really quickly. But I'm going to talk to you a little bit, introduce you into physical iridology first. So with humans, we used to think there were only blue and brown eyes. And then we learned that there are also mixed eyes. And you can see here that I wrote down here, blue eyes, those genetic tendencies with blue-eyed people is respiratory and lymphatic. Mixed-eyed people is going to be all digestive, liver, gallbladder, colon, stomach, pancreas. And brown-eyed people, it's mostly going to be blood, bone, and glands. And so it's really easy. You walk in the door and you're really not supposed to do that. You're not supposed to go to the store, and you're standing in line and you're talking to somebody. And while you're talking to them, you're going, "Oh, wow, look at that. She's got blue eyes. I know everything. She's probably got sinus problems and she's probably got problems with allergies and maybe she's got some arthritis." It's an invasion of privacy. So, when you're looking at somebody's eyes, you're looking not only at their eyes, but you're looking at who they are. You're looking at their health, but you're looking at their personality. You're looking at how they deal with things in their life and what they think and believe. And I mean, there's so many things you can learn about a person and how they, what makes them tick, what makes them, how they view the world and what makes them believe the way they believe and behave the way they behave. So there's a lot that you can learn about people from their eyes. So I kind of gave you a little bit there. So with blue-eyed people, blue-eyed people usually have issues with respiratory and lymphatic. So, sinus, like I said, lungs, allergies, joints, arthritis, things like that. Mixed-eyed people, this is me here. This is my eye here. Mixed-eyed people, it's usually going to be liver, gallbladder, colon, stomach, pancreas, everything having to do with blood sugar, digestion, colon, constipation, all those kinds of things. And brown-eyed people, it's usually going to be, like I said, the blood, the bone, and the glands. And so first, usually we work that way. We work based on, first thing is determining somebody's eye color. And, and then there's a whole list of things to do, what the tendencies are, what the specific diet should be for these people, what types of exercises they should do. And there's many, many different things. And then we look at a lot of other things. We look at the different colors that show up in the eyes. We look at anything that looks like a hole, anything that looks like a circle, anything looks like a line like this. I've got all of these rings in my eyes. You can all see these rings, right? My eye kind of looks like, think about if you go walking you go on a hike, you go walking and they've cut down a tree, right? You go into the forest and there's a tree they used a chainsaw and cut down a tree. And you go up to the tree and you're kind of curious how old it is and you count the rings in the tree, right? This is how it would look. My eye looks like a tree, okay? But in humans, this is basically stress, anxiety, it can have to do with sensitivity. It can have to do, it's how the body handles or reacts to stress. And so, like I said, when I first got into iridology, I was breaking out in hives all over my body because of stress. I was dating, so you don't even, right there, you know exactly how that is stress. And um, so, iridology really helped me. It's changed my life. Okay, I think without iridology, who knows where I'd be? But because with iridology, I've been able to learn about my body. And that's what I tell everybody. It's all about education. It's all about teaching people about their genetic tendencies and based on those, what to do. You know, what should I eat? What should what kind of exercises should I do? What kind should I meditate? Should I do yoga? What kinds of things should I do to help me deal with those genetic tendencies that are coming down from mom and dad and grandma and grandpa and great. It comes down from 3 to 5 generations. So not only are we bringing in our own tendencies, but we're also bringing in our parents, what happened to them, their emotions, their tendencies, our grandparents, and so on, so on. And so a lot of that's passed down. And so when we look at the eyes, we look at all the markings in the eyes. We look at this ring here, which is called the collarette. This is my son's eyes, by the way. This is my son here. We look at the collarette here to see the shape and the color. We look to see the fiber structure, how loose or tight the fiber structure is. We look to see if there's a ring around the pupil and what color that ring is, what's right next to the pupil. We look to see the size of the pupil, the shape of the pupil, if the pupil's flat, if it's round. We look to see if there's any rings, like I have this little opaque ring here. That gives us more information about circulation. We look to see with brown eyes if there's anything showing up on the sclera, and so on, so on. We look at all different kinds of things in the eyes. So what is iridology? Iridology is a study of the color and the structure of the iris of the eye as it relates to the genetic predisposition and health of the body systems. It does not diagnose. We can't diagnose. We're not doctors. We analyze, we assess predispositions and genetic inheritance. So we don't diagnose from the eyes. The old days, I call it the old days, we used to. We used to look at the eyes and go, oh, you have a marking in the breast, reaction field, and there may be, maybe you have some tumor growing in there. You need to go see the doctor. Oh my gosh, never do that now. Never. We look at those genetic tendencies and we can still see what may be going on, but we don't do any diagnosing. And we can't anyway, because the eyes don't show us those things. We can see genetic tendencies coming in, like I said, from mom, dad, grandma, grandpa. We can talk about, what you should eat, drink, what type of exercises, supplements, lifestyle, anything else that would help change your life or improve your life so that you're even more comfortable or out of pain and so on. And it doesn't name a disease, but it shows us what areas need nurturing. So what areas may not be releasing toxins, what areas may not be absorbing nutrients as well as they should, okay? And what body systems need strengthening. So these are some of the things that iridology can show us. There's a lot of things that iridology cannot show us, but it can show us the inherent strengths and deficiencies of organs, glands, and tissues, ability for an organ to react to illness, familiar patterns of syndromes and pathologies, foods that a person could have difficulty digesting or utilizing, areas of the spine that may have subluxation. We see that on the pupillary border. Nervous system issues, nervous system imbalances, circulatory disturbances, connective tissue weaknesses, glandular deficiencies, high uric acid levels, cholesterol levels, lymphatic congestion. A lot of these things, though, need to be confirmed. So, we can't say, oh, you have high cholesterol by looking at the eyes. We can see the potential, notice the word potential. We can see the possibility of it, but without following up with blood tests, we can't say for sure that somebody might have high cholesterol or high uric acid levels and so on and so on. So it shows us the potential for it, and then we need to follow up. A little bit about the history of iridology. A lot of people think, oh, it started with Dr. Jensen here in the United States, but that's not true. It's been in Australia. It started, way back in Egypt. It's in China, Greece, India, Italy, Europe, America, here. But, in Europe, they actually do use it to diagnose. And of course, we don't do that here. We don't do that here. I did some research on history, and I found, this is King Tut all the way back, 1922. Archaeologist named Howard Carter, he discovered silver plates in King Tut's tomb. And it's thought that those silver plates are the first lessons of iridology, all that way back. So then from there, it went to Africa, Tibet, China, Europe, and other regions. And so that's the very first, that's the very first records. This is Ignaz von Pessely, and he was in Budapest, Hungary. He's known as the father of Western iridology. He was a Hungarian physician. The story, and I've got the picture of the owl there, the story is that this owl got stuck in his tree. He saved the owl. He got the owl out of the tree. And when that happened, the owl's leg broke. He then nursed the owl's leg, and a line formed in the bottom part of the iris, which is the leg. And so we don't know if that actually happened. We can't prove that it happened because we haven't been able to, it hasn't happened again. So we don't know, but he did publish a book called Discoveries in the Field of Natural Science and Medicine, a guide to the study and diagnosis from the eye in 1881. And he's the one that created actually the first known chart of iridology. So that's a story, if you read about iridology, you'll read about Ignaz von Pessely and you'll read about his owl. And this is Dr. Jensen. He's, like I said, he was my mentor. I studied with him first. He pioneered science of iridology here in the United States. He wrote a book called The Science and Practice of Iridology. And he said, it's very interesting to note that although these men lived many miles apart and did not know each other, they all wrote similar books at the same time, even writing word for word in many instances. So, all of these people that have done research, and there's been research since. So IPA, which is the International Iridology Practitioners Association, which is who I'm involved with, comes from Dr. Jensen, because before he died, he asked his daughter-in-law Ellen to continue studying, to continue his research, and Ellen started IPA. So that's where IPA comes from. So we're still connected to Dr. Jensen after all of these years. We're still connected, which is great. This is the iridology chart that we use, and it's been edited by Ellen Jensen. And I was going to go over this really quickly. I can show this to you real quick and enlarge it here. So with human iridology, and I know I've seen and used the canine and the feline charts. This is a little bit more complicated than the ones that I saw. I don't know about the ones that you have now, if there's what I have, but so it works just like the body does. And the right iris shows the right side of the body, and it shows the father's side, okay, the father's family. And the left eye shows the left side of the body and the mother's side, okay, the mother's side of the family. And so it works just like the body does. So in the center of your body is the digestive system. So here we have the left side of the stomach and the right side of the stomach. And around that we have the digestive system, we have the colon. So we've got the left side of the small intestines and the right coming down. Then we have the cecum going across, the ascending colon going up. We've got the transverse colon going across here, the belly button, and then down the descending out the sigmoid and out. Outside the body is the skin. And so this dark blue ring right here, this is the skin. Right inside that, we have the lymph and the circulatory system, which is this light blue ring here. Top of the body is the brain, the head, the sinuses. So here from 11 to 1, this is the brain and the sinus, and we've got the pituitary and the pineal here. And that's the right side and the left side. And then down at the bottom, of course, we've got, the hips and the thighs and the legs and the knees and the feet and the toes and all of that. So here we've got the hips and the thighs and the knees and the feet here at 6 o'clock, the groin, the pelvis, and so on. And so that's the left side and the right side. Here's the spine here. So we've got the cervical and the thoracic, the lumbar, the sacrum, and the coccyx here. And everything else is in between. So we've got the heart. Anything that's in the center of the body is going to show up on both eyes, which is why you see the heart both at 3 o'clock in the left eye and 9 o'clock in the right eye. So you've got the heart on both sides. We've got the lungs out here, the breast here, these little lines right here. This is the ribs, and this little circle right here, that's the nipple. We've got the bronchus, the bronchioles on both sides, this here. And you can see everything else in here. We've got the adrenals here and the kidneys, the ovaries and the testes, the liver, the gallbladder, the thyroid. So we can't actually see the organs, right? We can't see the organs, but we can see the and unless let's see, all of a sudden now. All right, so we can't see the organs themselves, but we can see the actual genetic tendency towards that organ. So if somebody has an area of the body that is not absorbing nutrients or releasing toxins as well, then we may see some markings, let's say in the thyroid reaction field. Lots of people have thyroid issues now. And, lots of people have kidney issues now. So we may see a marking in the kidney reaction field or the thyroid reaction field or the lungs or so on. But that doesn't tell us, that doesn't mean that they have a problem with those areas. But we can do further, investigation to find out what's going on. So that's just a really quick kind of explanation about the human iridology chart and how we use that. These are some markings that we can see in the eyes. So I've got on here, anemia, cold hands and feet, somebody that has numbing the extremities. We see this ring here, this blue ring. It shows up on, it doesn't matter if a person has blue eyes, mixed eyes, brown eyes, it's still going to show up. And it's going to show up right here. Sometimes it's a light blue, sometimes it's a dark blue, sometimes it's kind of a purplish color. And that usually tells us that they could be anemic, especially brown-eyed people. That really is going to show up for brown-eyed people. They could be anemic. They can have cold hands and feet. Lots of people complain about cold hands and feet. And there can be problems with numbing down in the feet. Here's there's my eye. Now you can really see my eye. And so this is a stress, anxiety, sensitivity rings. We look at the rings, we look how many there are, and you can see I'm loaded with them. So you can see how many rings there are. I mean, that's what you mainly see. And so that can show us multiple things. That can show us, like I said, stress. That can show us how a person deals with their stress, how it can affect their body. So when I get stressed, My lungs. It affects my chest. My lungs can get tight and I can have trouble breathing. And these are the lungs over here. The lungs are over here, right here. And so you can see these rings going right through the lung reaction field. So if I get stressed, also I can break out on my skin. Like I said, how I got into iridology, I was breaking out in hives, big, huge hives all over my body. And I couldn't figure out why. And so I started seeing a chiropractor and they went away. And wherever these rings are, that's where it can affect my body, depending on how I deal with my stress. Okay, if the other thing that happens to me is that I can get my muscles. I'll hold my stress in my muscles, and so I'll get pain in my muscles. And so iridology has really taught me how to work with all those things. You know, I did a lot of trades in San Francisco when I had my offices in San Francisco, and I got massages. I got chiropractic treatments, and I learned, from my eyes how to deal with my stress. In emotional iridology, this has to do with achievement. People with these rings can achieve a lot. So it doesn't have to do with stress and anxiety, although being a high achiever can create a lot of stress. But in emotional iridology, it can have to do with, they're called achievement rings. So there's just some information about that. And if you look here, since you know iridology already, you know that the center of the iris next to the pupil is the digestive system, right? And so you would know, I'm sure you know this is the collarette here. And then inside here is the stomach and the colon. And of course, it's very dark. And these were taken years ago. These pictures were taken years ago. And the darkness usually means, the possibility of low hydrochloric acid, low enzymes, problems with elimination, and so on. And, when I got into iridology, I couldn't eat anything. I mean, I was just about on baby food, couldn't digest, chronic heartburn. I even tried Pepto-Bismol, the commercial on TV that says it shows you the stomach and how you drink it and it lines the stomach. Didn't work. It just made it worse, you know. And so I had all kinds of problems with my stomach. And now really very little, from using the herbs and working with my diet, my lifestyle, all those things. Lots of things have changed. So my eye is still the same. So with humans, the iris really doesn't change. It does a little bit. It's more accumulative. So what that means is that usually with human eyes, we gain more pigment. So we'll gain more pigment. We gain more markings as we get older, more rings. So for instance, this ring here that I have that's kind of light here, that ring can get thicker. It can get brighter. It can go all the way around the iris. Some of these pigments that I have in here, the dark brown, I can get more pigments because I've got orange in here as well. And so with human iridology, very seldom do we see those colors leave the iris. Even with deep cleansing, we usually don't see it. It's mostly accumulative. So bringing clients back over time as they've been working with their body and working with their diet and with herbs or homeopathy or whatever they're doing, we'll look at the iris to see if there's more accumulation from the organs, but we'll also look at the sclera because the sclera will change. So I'll have clients come in that have very dark sclera lines showing up, and as they are working on their health, those sclera lines will lighten. They'll actually lighten up at the ends and go backwards. And so that's what we want to see. We can see, like I said earlier, we can see yellows, orange, we can see brown, we can see gray, we can see blue, we can see black, we can see lots of markings in the sclera. And then depending on how thick those sclera lines are and where they are, that can tell us, if there's, cardio or potential cardio being passed down through generations, if there are viruses, if, we can see fungus, parasites, we can see many things. We can see how well a person can detox at a really deep level, lots of things based on the sclera. based on the sclera. This is a really great picture to show you what a cholesterol ring would look like. And this is a pretty severe cholesterol ring. I usually don't see them this white, but this ring here in human iridology, physical iridology, has to do with cholesterol, blood sugar, blood pressure. It can show up if the blood pressure is high. It can show up if it's low. It can show up if somebody has hypoglycemia or diabetes. It can show up if the cholesterol is high, HDL, LDL, if there's imbalances in triglycerides, any of those things. And just because they have this ring doesn't mean that they have any of those problems. Because I've had people, I have a young client, a male who came to me that his mother and his father both passed from heart related issues. And he wanted me to look at his eyes and tell him if he was going to die of a heart attack or a stroke. And you know, I looked at his eyes, and sure enough, just one second, I looked at his eyes, and he had the ring, so I had to tell him, "You've got the ring." And then we ran blood tests to check, to see what was going on with his blood, and everything came back perfect. He had a really good diet, everything was great with his diet, and so as long as he keeps doing what he's doing, he's probably going to be fine. Charlene and Callie, you guys have questions?
Yeah, will you use your mouse to show us what white ring you're talking about? Because I
Oh,
see three different ones.
this one right here. This is a glare, if you're looking at that. This is a glare, and this is a continuation of the white ring. This is the ring here showing circulation, this blue ring right here, that's showing circulation. But this is what we know as the cholesterol. It's called lipemic diathesis in iridology. This is a glare from the camera, from the flash here. But this is
Okay,
the
so
ring.
you're talking about the outer ring around the whole entire eye.
Yeah, it's usually going to show up kind of towards the perimeter of the iris. So this would
Okay,
be zone 6 here, which is where circulation shows up. Yeah,
okay, thank you.
sure. Did somebody else have a question or no? Okay. All right. Okay. All right. So that kind of gives you some ideas there, some of the things that we can see. And this you would see in a person walking in the door. This is pretty severe, and you could see this from far away. I've seen this in dogs too, where they have the ring, the really bright ring. And so um but we can see, I don't know, can you see that in horses? Do they have these rings?
Um, not Cheyenne, what do you think? I don't see that so much. Maybe a little bit in dogs. So
Right,
we
more in dogs than horses.
we see a lot of blue, the outer
Yeah.
blue beyond the scurf rim,
Mm-hmm.
which
Okay.
I've been calling low oxygen.
Yeah, yeah,
And O2
exactly.
absorption.
Yeah.
Mhm.
Cold hands and cold feet. Yeah, we usually increase oxygen. Yeah.
Yeah.
Mm.
Okay, good. Good.
Yeah, we're on the same page. Yeah, with humans, it's like, let's get you moving, right? Let's get you moving. I usually give them chlorophyll to help with that oxygenation and get them moving. There's a scurf rim. Yeah. So here's the scurf rim here, and this has to do with the skin elimination. And from far away, the person would look like they outlined their eye, right? It's really pretty. And what we've learned is, we used to think this would go away. We used to think that if you use a skin brush for a year, that scurf rim would go away. But we've since learned that it has nothing to do with that. It's actually a thinning of the iris fibers. And so you can see here, if you look at it, you can see that the iris fibers that are on top are thinning. And so you're seeing the underlying layer in the iris. I mean, you know that there's 4 layers, right, of the iris, and the top. No, okay. So the top layer is called this anterior border here. This is the top layer, and that's where the color shows up. So if it's blue, it doesn't have very much pigment or no pigment, and then if it's a mixed eye, it's got more pigment. It's going to have yellow, orange, brown, some of those colors. And if it's a brown eye, then it's going to have all pigment, right? It's that melanin that tans you. And so then it'll be completely covered with the pigment. And so when we're looking at the iris and we're looking at these areas, these little lacuna here, we're looking down the layers in the iris. So we're looking down. The very back layer is black. The very bottom layer is black. That's that posterior epithelium. And so now I'm going into anatomy and physiology. So this is the very back layer here. It's showing up, the very bottom layer. And what that does is comes from the perimeter, it comes in and it curves at the pupillary border, and it actually makes this border right here. So it comes in and it curves, and that's what you see when you're looking at that. When you're looking at the pupillary border right here, is you're looking at that what's called that posterior epithelium. So the darker the lacuna, when you're looking down into those lacuna, it's going down those layers in the eyes, and the darker it is, then it usually has to do with areas of body that are possibly not absorbing nutrients or releasing toxins as well as they should. And the darker it is, the longer it could be there, or it could have been there, or the more problems that can occur.
Degenerative.
I don't use those terms.
You
Notice
can't.
I was
Okay.
being very careful with my verbiage. Yeah, we used to use acute, chronic, subacute, degenerative, and all that. Chronic. Yeah, no, we don't do any of that. So, we're mostly looking at the tissue integrity, and then also areas that are, like I said, absorbing nutrients, releasing toxins. I mean, it still means the same thing. If something is a little darker than the natural color of the iris, then, you could say it's subacute, or you could say that it's just probably not absorbing nutrients as well as it should, or releasing toxins. And that's usually when it's something that's going to bother somebody once in a while. It's not enough to send a person to the doctor. Whereas if it's even darker like this is pretty dark here. So this would be probably something you'd call chronic. And that is usually, when somebody's having the symptoms, most of the time, every day, and then they're going to run to the doctor to see what's the problem, and then they're going to get on meds that are, or they may come to somebody like me, or, to an iridologist to find out what's causing it, so that, we can then look at that area and say, oh, okay, so this is at 3 o'clock here. That's right. That's right in the throat reaction field, or wherever it is. And there could be symptoms, or they may not be. So, we can look at that to determine that. But that's what you're looking at. When you're looking at the iris, you're looking at the top layer, which is that anterior border layer, which is where you see the color. And then you look down into the layers. And each one of those, each one of these, this is just kind of open here. And so you can see the light underneath it, but it's not real dark. Whereas this lacuna here is. And then, of course, depending on where it is, depending on which organ reaction field it's in, depending on if it's next to the collarette, depending on where it is, that can tell us, what could be causing issues.
So Mercedes didn't really dive into zones much, and we haven't proven zones in canine, feline, and equine.
Okay.
Yeah,
we've got 7 zones. So for us, here, I'll just enlarge this.
we're exploring it, but we don't have proof.
See this ring right here? I'll enlarge even more. You see this ring right here?
The pupillary ruff.
That's that you call it pupillary ruff. Yeah, the
What do
pupillary
you call
border.
it?
Yeah, pupillary ruff. We can call it that too, but I usually just say pupillary border. That's coming from the very bottom. That's what you're seeing here. That's that posterior epithelium that's coming across here and curving. That's what you're seeing. Yeah. And it's really cool. And sometimes, you can look at it. We just looked at one in class the other day. It looked like somebody had just, embroidered it all the way around. It looked like thread that was embroidered. Sometimes it's missing pieces, but
What does
these
it
are
mean if it is missing pieces?
this has to do with the nervous system here. It has to do with the spine. And so when we look at the pupillary border, this has to do with the spine. And so wherever there's flattenings, in the pupil or missing, that can have to do with the spine.
So same with dogs and cats, but are you, Cheyenne, what are your thoughts about the horse's pupil?
So on the horses, it will show up as little pockets down there
Mm,
on it. And so we're trying to figure out right now, is that something to do with the stomach? Or because at the top of the pupil, there's great, it looks like mountains, and we call it the granula iridica. And so at first we were like, okay, maybe it's a granula iridica on the bottom, but we've since thought, no, that's probably not it.
So
Could be stomach issues.
we've done
So
about 8 dissections, and all of them that have that on the bottom all have stomach lining damage.
mm,
Yeah, and
mm,
it seems to be the bigger it is, the like it seems to be absolutely indicative of the size even. Right, Shane?
yes.
mm.
And Brenda, for sure, it's the same with dogs on the flattening of the pupil. Now, with horses with their oblong oval pupil, that doesn't show correctly like a round pupil will. So we can tell if they need an adjustment in a dog. In the horse, we have to look elsewhere in the iris because okay, this is probably the best way to describe it, how the sclera shows you up to date in humans. The
Mhm.
iris actually does show up to date in the animals, and it can change. I have videotaped it changing within 43 seconds. And so
Wow.
the
Yeah,
iris itself will show markers that will disappear immediately upon adjustment or getting the
application.
circulation going. So we don't have to look so much as the sclera in horses. The iris will give us the up to date, where in humans, it's the other way around.
Yeah. Well, okay, so so this is the stomach right here. This
Yes.
ring right here. This is zone one. Is it the same for
Yes,
animals?
it
Okay.
is in dogs and cats
Okay, so
and horses.
this is zone one here. Sometimes it shows up, sometimes it doesn't. This side shows up. And then here, this is zone two. This is the intestines. Um,
Yes, so far so good.
yeah, and then of course the collarette. We look at the collarette. This is a double collarette. We can see, the shape of the collarette. How thick the collarette is. If there's two of them. If there's bridges, this has bridges. So all kinds of things. Then this is zone three. This is the blood. This is the humeral zone. This is where the blood goes in and out of the intestines. That's zone three. This is where we can see, and I'm not supposed to say this, but I'll do it anyway. This is where we can see problems with the gut lining, the lining of the gut here.
Interesting.
Yeah, and then we go into zone four, zone five. This is the muscles. We got the bones out here. And then here we've got lymph and circulation, zone six. And then the skin is on the very outside, which is what I showed you. That's zone seven. And then out here, we have outside the iris, we have limbic. The limbic system is, which we don't teach that until level three,
Okay,
but the limbic system is out here.
interesting.
Yeah. So that's how it works with humans. And like I said, with humans, like here, you can see this little pigment here and the little teeny pigment here. We normally don't see these go away unless it's created by meds. So if somebody's on medications and the medications are creating those deposits in the iris, and then somebody stops the medication, then the pigment will go away.
I'm
But
so glad you brought
normally,
that up because
yeah.
what we're seeing in equine and canine is if they're on painkillers, it will make the eye look falsely good. So because it blocks the pain receptors and it doesn't mark on the iris very well.
Interesting.
Yeah.
Well, just like you can't see surgery, when somebody goes through surgery. So, I'll say, "Oh, look at that. You're having problems with your appendix." They go, "I don't have my appendix." It's like, "Oh, well, that was the problem before you had it removed." Because it doesn't change after it's been removed, right? So, yeah.
Interesting.
It's
And
interesting how similar and different, right?
yes, it is. And I mean, Mercedes gave us permission to change her grid, so we've added some marks. But the Ellen Jensen having the multiple lobes of the liver, that is not us. We don't have multiple lobes, and we don't have the heart marker on both sides, which
Yeah.
maybe we should, but gosh darn it, it is so accurate.
Yeah. And Dr. Jensen's chart, the chart I used for years, didn't. It only had one pancreas reaction field. It only had one heart. It only had one liver reaction field. And then there were things that were missing.
I'm
Like it didn't
so
have it.
I'm just so thrilled you're bringing all this up, because that's been some of the questions in my clinical course is why isn't it on both sides? It looks like the pancreas goes on both sides.
Yeah.
So
Yeah. Well,
quadrupeds versus bipeds, I was like, well, maybe it's just different, but it does go through that ventricle line.
yeah. And as you continue doing your research, that you guys are doing, you're probably going to continue to change the chart. I mean, um, the pancreas for humans is in eight places on the chart, at 2, 4, 8, and 10 on
You're
the collarette
you're kidding me.
on
Oh,
both eyes, both eyes. So yeah, so it's going to be 2, 4, 8, and 10.
what the heck?
Those are the pancreas, but that's just the pancreas reaction field. There are other markers when we're looking at the eyes. There are other markers that we can see. We can see what's called mammillations that looks like somebody just made a whole bunch of little dots. Almost looks like freckles.
Peppering.
That has
I
to do
call
with
it peppering.
yeah, that has to do with pancreas. We can have a bridge. Somebody can have a bridge. This is a bridge. This is a bridge right here where it's going. It's inside the collarette. It looks like you can kind of put your finger underneath it. So, like a rubber band. That's a bridge. That's a pancreas marking. They can have a square collarette. So this collarette is not. It's a little square, but it's usually going to be flat. More flat than this. And it doesn't necessarily mean that it has to be on all four sides. Usually it's not. Square collarette has to do with pancreas and blood sugar, genetic pancreas and blood sugar. Orange in the eye has to do with pancreas and blood sugar. There's so many markings in humans, and it's good that there's so many markings because blood sugar is the epidemic now with humans, right? Diabetes is huge. It's a huge problem. And so people have multiple markings in their eyes. Yeah.
That's amazing. In dogs and cats, so especially cats, the pancreas and the gallbladder are actually connected, and you'll see marks almost on top of each other. So the anatomic way it's built is like this, and then it also marks on the iris like that. And usually you'll see a gallbladder and pancreas together as
Mm-hmm.
as a mark in a dog and a cat. But
Mm-hmm.
horses don't have gallbladders.
Yeah, for us, they're next to each other. So there's the gallbladder, then the pancreas is below, a little bit below that, and then the liver's out here. So it'd be right about it here. We'd have the gallbladder, pancreas, and then this would be liver here in this area.
Okay.
And so sometimes there'll be markings in all of the above. Sometimes there can be a pigment, there could be a lacuna, there could be both. There could be radial furrows, which are these lines here. There could be multiple things that can show up. And sometimes I've had clients where they have markings in 6 of those 8 pancreas reaction field markings. It's genetic. It's coming in from mom and dad, both sides. Remember, the right iris shows the dad and the left iris shows the mom. And so we're looking, and so when we're talking to people also about personality and physical genetic tendencies, we can figure out if it's coming from the mom's side or the dad's side, which is pretty cool.
So
And
radial furrows, Mercedes always taught they were parasite lines. In cats and dogs that eat a lot of hair, I see radial furrows. I see foreign body hair marking as a radial furrow. So cats with hairballs, radial furrows.
yeah, well, That's old physical iridology, as I call it. So we've since learned that that these are not parasite lines, that this has to do with the nervous system because it's usually coming from inside the collarette and breaking through the collarette. And wherever it breaks through I feel like I'm teaching a class. Wherever it breaks through a collarette, it can cause problems here with the nervous system to that particular organ that's outside the collarette. So we look inside the collarette at that part of the stomach, and then we look outside the collarette for the organ that's out here.
Interesting.
And where we see the potential for parasites, I know somebody was just asking me for a picture of parasites. Well, what we'll see is we'll see what's called a honeycomb in the collarette, which think of a bee honeycomb, right? That it's a large area with a lot of circles in it, lots of lacuna in it, and it can be a tonic, meaning that the collarette could come out wide here, and so that could be a place where a person could have parasites or the condition towards parasites. And then, of course, on the sclera, it'll look like a line that just kind of goes all over the place like this. I'm
I resemble
not,
that.
I'm not going to say anything.
I resemble that.
You resemble that? Yeah. Well, okay, I'm not saying anything. All right.
Okay, thank you for helping us understand that. And yes, they are a little different and it's interesting all the way around because of the neuro studies we've done with the equine protozoals that cause neurologic issues actually touch the pupil and radiate out in a squiggly line, though, kind of like what you're seeing on the sclera, but like a wavy line up through the brain region. But they always touch the pupil and go up in that 11 to 1 o'clock region.
Mm.
In the
Well,
digestive tract.
I'm loaded with radial furrows. I mean, I've got the standard. I have the rings that go around my eye, and then I've got radial furrows all throughout. And so, I mean, I've had my share of parasites over the years. I've gone into expos clean and come out with them. So,
Wait, what?
yeah, Whole Life Expo. I don't know if you've heard of that. The Whole Life
Yeah,
Expo,
yeah.
in San Francisco.
I went to the LA one or Long Beach, I think it was.
I used to do the Whole Life Expo twice a year in San Francisco, and I muscle test myself all the time. And I went in without them, and I came out with them.
That's so gross.
So, and I only ate the food there that was supposed to be all organic and and all that. So who knows? I could have picked it up from a person that I touched, maybe, or some lettuce that they didn't wash. Who knows? Who knows? But it's so much easier to get them than it is to get rid of them.
You're the hostess with the mostest.
Yeah, yeah. Okay. How
I'm
long do you
learning,
want me to?
I'm learning so much. Thank you.
How long do you want me to talk? What?
As long as you want.
Okay, so that was the end of the physical. This is emotional. I can go into this. The emotional iridology. This is Denny Johnson, and he teaches RAID. So you can get this really cool book if you want for free. It's called What the Eye Reveals, and here's the website www.raid.com. And this goes into the emotional. Parasites are more commonly. Thank you, Rochelle. I didn't need to know that. Parasites are more commonly found in organic foods. Okay. All
It
right.
makes sense, though. It does make sense because they're not using stuff to kill them.
Sure. But anyway, this is Denny, and he's the one that came up with the RAID model of iris interpretation. And now this is completely different from physical iridology. We don't look at it the same. Where you would look at pigments, right? Brown pigments from the liver, orange pigments from the pancreas, yellow pigments from the kidneys, and so on. He looks at them as jewels, and it has to do with personality. So I'll go through this, and I'll give you an introduction here. So, the iris of the eye is like a fingerprint. Everybody's different. So much of your personality has to do with the ways in which you process and respond to auditory, visual, touch, and so on. And so the different patterns in the iris of the eye, they're directly correlated with specific behavior characteristics and ways of processing information. So here we have 4 different types. We have the jewel, the shaker, the stream, and the flower. And if I look at physical iridology, the flower in physical iridology is called a polyglandular. That's somebody who, their eye looks like a flower, and that's somebody that has to work on their glands in physical iridology. Okay, they're going to be very flowery. A stream in physical iridology would be somebody that's neurogenic, and that is somebody that's really in their head a lot. And a jewel, we don't even call it that. We call them pigments in physical iridology. It's where the body, so like these pigments here are kind of orange. And so that can be liver, or it could also be pancreas. And those pigments can deposit in those areas of the body that aren't strong enough to keep them out. And so with a jewel, we're just looking at pigments. With a stream, we're looking at the straight fibers. With a flower, it looks like a flower where they have those lacuna all the way around. And a shaker has all the above. The shaker has everything. The shaker has the pigments, it has these lacuna, and it has straight fibers all above. And the shaker is exactly that. It's somebody that shakes things up. If you want something to happen, you go to a shaker because they're going to be the movers and the shakers. They're going to get it done. So he goes strictly on personality. So the eyes have been called the windows of the soul. 40% of the cranial nerves going into or out of the brain are just for the eyes. That's amazing. And so that's probably why Rayid, it taps into the inner world so well with people. So information in the iris patterns allow us to understand, and this is based on Rayid, how an individual primarily assesses information, what that person's prime mode of communication is. And this helps in any relationship, right? Knowing their prime mode of communication, the fears that motivate them, their gifts and talents. Maybe they don't even know what their gifts and talents are. Their inherited patterns of behavior and reaction, how this can impact their health and physical well-being. Their prime lesson in life, why are they here? What are they here to learn and to teach? To allow them to become a balanced, healthy, and whole individual. Type of relationship, that they're most likely attracted to. However, don't go into that, who they should or shouldn't marry, like I said. And an individual's immense personal potential for growth. There's so much here, so much that you can learn about a person just from looking at their eyes with red. So you could do physical iridology on a person and learn all about the physical, those genetic tendencies. And then you can do the red and look about the emotional side of it. You put it all together, and that totally explains why they're having the physical problems that they're having. It's coming from the emotion, right? It's always the emotion that's underneath. Always the emotion that's underneath. So, well, there you go. I just said that. We know that underneath all physical ailments are suppressed emotions. And the more I work with clients, the more I understand, about dealing with, looking at past traumas and fears, what's driving them or stopping them from achieving their goals. So helping them to deal with their emotions, is huge. And we are an emotional, spiritual being living in a physical body. So what I like about Zyto is that it does scan the emotions. So it'll scan them, and then I get to talk to people about it, which is really great. This is an emotional chart here, and this talks about some of the emotions. So you can see escapism and being a martyr, stubborn, altruism, and so on and so on. Idealism, will, rebellion, heart, nurturing, anger, jealousy. So there's all the good things in here too. Self-reliance, inner truth, or voice, speaking their truth, counseling, listening, and so on. There's lots of charts out there. I just grabbed one off the internet. There's lots of charts that can be used for emotional iridology. And there again, the right iris shows the dad's side and the left iris shows the mom's side. So to make it even more complicated, if you see a marking, like a lacuna or a hole in the left eye, in the lung reaction field in the left eye, that has to do with the mom's side of the family. And then you can ask the client if they're having problems with their mom or other women in their life. And 9 times out of 10, they're going to say yes. Or if it's a marking in the left eye, like in the throat reaction, say in the throat reaction field, they have a marking in the throat reaction field. In the right eye, you can ask them if they're having trouble communicating with their dad or a male figure in their family. So it's pretty impressive. It's pretty amazing because not only can you see the physical in physical iridology where they may have an issue, in the throat or the thyroid. Okay, so you can think, oh, okay, so they have an imbalance in the thyroid. Maybe thyroid runs in the family, and maybe it's on the right side, so it's the dad. But in emotional iridology, we can go further than that and ask them, how well do you communicate with your, with your dad or other males in your family and so on? Because most people don't communicate. They don't. They're not able to communicate. Anyway, that's just an example of how you can use both to, to assess or to talk to clients and talk to people. So these are the 4 Rhea types. Jewels are more mental. Flowers are more emotional. Streams are more kinesthetic, so more touchy-feely. And your shakers, they're all over the place. And if you understand these 4 types and the relationships between them, you can understand the basic theory of Rhea. So the jewel and the flower, so you got the jewel here, and what makes it a jewel is the pigments. Okay, that's what makes it a jewel, is they have pigments. And what makes this a flower is that it looks like a flower. It's got these, outside the collar head, it has all of these lacuna. Okay, so that's what makes it a flower. And the stream, what makes it a stream is it has nice straight fibers, tight, straight fibers. What makes this a shaker is that it has all the above. It has the lacuna, it has pigments, and it has a straight fibers. So they go across like this. These are opposites, and we know opposites attract, right? So the jewel and the flower, they attract each other. Whereas the jewel is constrictive and controlling, while the flower is expansive and emotional. And so they attract, the people attract each other to learn and come together if they can, right? To work towards each other. And the jewel is like the force of gravity, the constant binding force, and the flower represents expansion and freeing. So these types are attracted to each other. So this is a jewel type. There's a jewel. Where I would call that a liver pigment, I would call that a pigment in the liver. I'd be looking at the liver reaction field. I'd call this a liver pigment. All of this has to do with MTHFR. It all has to do with, in physical iridology, it has to do with methylation or the inability to methylate. Rayed is going to call this a jewel and talk about the personality type. Talk about that. And there can be many jewels. And talking to a person about their personality is a lot more fun for the client than talking about, oh, you need to do some liver cleansing and some, and maybe work on the pancreas and balancing out the blood sugar and so on and so on. And this is a flower type. I mean, doesn't that look like a flower? It does, right? It looks like a huge sunflower. So there's the flower type. Very expansive, lots of space. Lots of space. We always say that somebody that has looser fibers, they're easier to get along with. They're easier to get along with because they let things fall through the cracks. And so you see lots of space there. So they let things fall through the cracks.
So they're looser people.
Yeah, they're usually a little easier to get along with most of the time. It also depends on their life. It depends on what they've been through. We've got that 80-20 rule, right? Where 80% of the time it is, and 20% of the time it isn't. It can also be a learned experience where, in physical iridology, this is genetic. Okay, so in physical iridology, when we look at this is a polyglandular. This is somebody that needs to work on their glands. And I would ask them, you're a little bit more easier going. They may say, absolutely not. This is how they were born. Genetically, this is how they were born. But maybe based on their life, what they went through as a kid, maybe they were bullied in school and they had to get tough. Maybe they went to college, they became an engineer. And so they're an engineer now. They're very much in their head. So they're different than their genetics is, right?
Brenda, that's an amazing photo.
Yeah, too bad I didn't take it. It is pretty amazing. You'll find that in the raid book. It's pretty
beautiful.
Cool. Yeah, it is. It is pretty. Yeah. You can really see the zones here too, right? You can see the stomach zone here. And then, and then this is all the bowel here. This is huge, huge bowel. And that's the other thing. You can tell a personality based on the size of the collarette. So if the collarette is really tight towards the pupil, then they're going to be more introvert, more private, more timid. They're going to go into a party and kind of go in kind of quiet, maybe kind of hang out, kind of feel it out a little bit. Somebody like this that has a really large collarette, are you kidding? They're going to be like going into the party and get in there and start dancing right away, be the life of the party.
Wow. That's amazing.
Has anybody here seen Footloose?
Yes.
So if you've seen Footloose, that's my perfect example. You remember towards the end of the movie where they have the party in the barn, right? And everybody's just standing around. They got the lights on. It's boring. Here comes Kevin Bacon and his date, and they walk in the door and they're like looking around. They come on, let's dance, right? And the music just starts, right? And everybody's just going. There you go. That's somebody that's very extrovert. They come in and they're the life of the party.
So have you looked at Kevin Bacon's eyes?
No, but that's the part he was playing, So who knows who he really is? No. I've looked at other people though.
Anytime I see him on the big screen, I can't help. But I don't know this stuff.
Yeah, I have to be careful because, I look at, actors and actresses when they're on my TV and I'm like, oh, look, there's a mark in his kidney or look. So in face, when you learn about the face, there's a crease, and hopefully I don't scare anybody here, but there's a crease that goes right along the bridge of the nose here. And that's pancreas here, right here on the bridge of the nose. Oh. There's a late night person that I watch that has a huge crease going right across his nose. And it has to do with pancreas. And once in a while I'll tell my husband, God, I wonder if he's got blood sugar problems. But I don't
You're like trusting that they have excellent concierge doctors.
Yeah. Just know, it really is an infringement of privacy. You're not supposed to do it. You're supposed to be careful. Here's some more information on the jewel, the stream, the shaker, and the flower. The stream personality represents strength. So the stream, it's got nice tight fibers. And so we think of that as a neurogenic in physical iridology. In red, it's, same kind of thing though. Strength, tenacity, groundedness, that's needed to nurture, support, and hold. Personality of the shakers, they're all over the place. They're based on movement, like a spinning magnet. I think my son's a shaker. I finally figured him out. Primary mode of communication for the shaker is movement, often expressed through big gestures. They talk like this, right? Big gestures. Shakers represent the energy of attraction and constant motion. And the stream, who's very stable and strong, is attracted to the shaker, who's all over the place. And the shaker needs that stability. So they're attracted to each other. The stream is attracted to the shaker to open up, and the shaker is attracted to the stream to get some more, to get stronger and have more groundedness. It's really actually pretty amazing if you think about it.
It's crazy how he could ever think this up. Like, how would you ever put all of this together? That grid with all the emotions. It's insane.
Well, there's a lot of people that are doing a lot of research, lots of research.
So
And
exciting.
it's, Denny Johnson's been around for a long time. So here's some examples of streams. So on the stream, so my eye looks like this, right? It's got the rings and there's all the radial furrows, right? More radial furrows. My eye, I'm definitely a stream. And then there's also rated for children. So, people that have children, right? Teaching parents how to work with their kids based on their personality is amazing. And I just taught a class this morning about that, RAID in schools, working with children, because you've got flower children, you've got stream children, you got shaker children, you've got jewel children, and they all learn differently based on their personality, and they all act differently. They're all affected differently, right? Based on how the teacher talks to them, how, what they learn, how they learn, they all learn differently based on their personality. It would be amazing to use it in schools. It would really help. And teaching parents this stuff, like teaching parents about physical iridology, how, their kid, maybe they have blue eyes and their kid has mixed eyes, or the opposite, maybe they have mixed eyes and their kid has blue eyes. Their child should be eating totally different than them. But as a family, everybody eats the same way, right? And some people have problems with it. Like my parents, typical Italians, pasta, milk, cheese, the whole shebang, right? And my parents didn't have problems with it, but I did. And so, so if they had known based on my eyes, that I shouldn't have been eating those things, they would have fed me differently, right? And so it's huge for, especially for kids. It's huge. Here's a beautiful picture of a shaker. I have a client that's a lawyer, and she's a lawyer for helping people that have been unjustly convicted, and she's a shaker. She just gets in there and just really shakes. And just talking to her, you can tell she's a shaker. She gets in there and she shakes everything up. So there again, they've got the lacuna here, they got the pigments here, and the lacuna all around, and they've got the nice fibers here also. So that's somebody that's a shaker. And we never diagnose, we never tell them, hey, you're a shaker, or hey, you're a polyglandular, or hey, you're this or that. We always ask. We've got all the questions to ask to confirm these things, like I did with you. Remember when you were here? That's what I did with you. I asked you the questions. I didn't tell you, right? Certain things I did, but I also know that you're an iridologist, and so I did a little bit more. Jewels are typically strong, enduring, analytical. They're not as transient, emotional, or as quick to change as flowers. And there's the opposites, right? The flower personality is very similar to the cycle of a meadow flower. They attract the bee. I love this. They attract the bee by its bouquet, radiance, and beauty. So do feeling-oriented flower types attract other people. So flowers wordlessly accept the world around them. And then you got streams, that they're the consolidating force in nature. They represent water that moves through the earth. They're nurturers, community builders, nest makers. They're a crib of creation. They touch and connect, inviting everyone to join in the experience of connectedness. They're the essence of embodiment. And in shakers, they're the power of nature in motion. They can affect a sudden and dramatic change in the consciousness of those around them. They're like an earthquake. I love that. They're like an earthquake. They set all of the other structures in motion. So you want to do something, you go to a shaker. You want to get something moving, you go to a shaker. Yeah. Okay, this is something else I do. I run the Zytoscans, and the Zytoscans is like a lie detector test. So I do have a student actually that's a police officer in North Carolina. And he came to me to study iridology, and he actually does lie detector tests on people that they arrest. And he also uses Zyto. I was like, and he told me, he says, it's the same idea. The Zyto just uses galvanic skin response, and lie detector test uses the same. It uses, body temperature and breathing and all those things. So it's pretty interesting. Um, Hi, Yolanda. His book is good thus far. Are you talking about Denny? Saw your comment there. So the Zyto balance, the Zyto scanner, it scans all the parts of the body. And there again, it can't diagnose, but it is FDA approved. So it can scan the body, and it scans for stressors. So knowing, and I don't know if you have something like that for animals that you can scan them. Do you have something like that?
So
Some way to
I'm
scan?
muscle test, and we've interviewed a lot of people that have different types of scanner, like NES Health. Um, but I've used Zyto on a dog before.
Yeah,
Yeah,
yeah.
so we just put the dog paw on the Zyto machine, and it read it just fine.
Really?
Yeah,
How do you get the dog's paw to stay on there for 10 minutes?
we just put it on there.
And they'll keep their paw there?
Yeah, he just laid down and hung out.
Like the dog I had in San Francisco. I had this little teensy weensy little office in San Francisco that had my desk, and I had a chair and my camera, and that was it. And these ladies wanted to bring me. They had a huge dog. I'm not sure what it was now, but they wanted me to do his eyes. And this is before I used cameras, so it was a flashlight and a magnifying glass. And he just comes in, he lays down, mellowest dog, and and I kept looking at his eyes and looking at his eyes. He was on a better diet than they were. He was on all these supplements and everything. And he was just so mellow. It was so fun. So fun to look at his eyes.
Yeah, you could have Zytoed him.
I didn't have the Zyto then. That was like in the very beginning when I was in San Francisco. So anyway, this is something
I'll
else
bring
I
my
do.
dog, and you can play with Zyto on my dog.
I would love that. That would be
Okay.
so fun.
Yeah.
That would be so fun.
He's big energy, but yeah.
I have a lot of people that use pendulums.
Mhm.
I have several people. It was fascinating the other day. I had a lady that was testing herself with her pendulum, and it is crazy. Just watching it, she'd ask questions, and it'd go to the right, and then it would stop, and then it'd go to the left, and then it'd go straight. And I just sit there and watch it, as it's going back and forth. So I have people, do that as well. And I do muscle testing too.
Yeah.
Okay, so I want to invite all of you to our open house. We're having an open house Wednesday night from 3 to 7, and we're going to have raffle. We've got food and drink, and this is all my wellness center here. I've got somebody here that does Reiki. I do, of course, the iridology. I've got somebody that does brain spotting, works with a lot of people with traumas of all different kinds. I've got somebody who does natural skin treatments, waxing and facials and all kinds of things. I've got somebody who does frequency healing. I've got another naturopathic practitioner here who's also a Pilates instructor. I've got a couple massage therapists. I have a lady now that's looking to maybe join us that does hypnotherapy. So we do a lot. We do a lot here, which is really great. And I wanted to make my wellness center a place where people could come for the analysis, and then they could also get the help that they needed. And so it's really great. It's become that, and
I've
I'm really
never
happy about
heard
it.
of brain spotting.
You never heard of brain spotting?
Never.
Do you know what EMDR is?
No.
EMDR, okay, so it's a rapid eye movement, but with EMDR they do a lot of tapping, and there are places in your body that you hold emotions and you hold past traumas.
So EMF. Wait, emotional freedom technique. EFT.
Yeah, EMDR,
Okay.
emotion.
Everybody
Yeah.
has their own little acronym for things. I think they like convert it a little bit and then they change the name.
Ah, okay. Well, so like for instance, my daughter, her she was having a lot of pain in her leg, her knee, and I think it was her left knee and left thigh, and she couldn't figure out why she was having all this pain. So she had EMDR, and she found out that she was holding an old memory in her leg from when I took her to our friend's house and uh, her dog and to go swimming. And my daughter went down the slide, and the dog thought it was playing, and it went to get her when she came down the slide into the pool. So the dog was playing, but Josephine freaked. And all these years, she's held that trauma and emotion in her leg. And so the EMDR through the tapping, that's helped her to release that. So she doesn't have the pain anymore.
Very cool. Interesting.
And, yeah. And so brain spotting, what they say about brain spotting is that it is EMDR. It goes deeper and faster. And it's EMDR on steroids. So what brain spotting is it comes from EMDR, and they determined that there are places you hold these deep memories in the back of your brain, and there are places that you look when you hold different traumas or when things happen. So, like for instance, let's say you were 10 years old and your teacher yelled at you, and you're this little kid and the teacher is this tall. And so every time something like that happens where somebody yells at you, you're triggered. Okay, you're triggered. And all of those memories throughout your life that have to do with being yelled at get saved in the back of your mind here in like a little capsule. Think of a capsule like an herbal capsule, okay? And that capsule will hold all those memories that are like what happened to you when you were 10 years old. And so what brain spotting does is it determines a spot. You find that spot that you're triggered, and then there's sound that goes back and forth, and you look at that spot, and the under safe conditions, the capsule opens and all of this stuff comes out.
Interesting.
It's amazing. I've had it done.
I
It
will
really
have
is
to
amazing.
explore that.
It's amazing. I can give you an example. The last time I had it done because one of the people that was here told a lie about me, and I have an issue with people lying about me, but I got really super upset, and I couldn't figure out why I got so upset. So I thought, well, I'm going to go do some brain spotting and see if I can figure it out. And it took me all the way back to grammar school. All these events throughout my life, people have made assumptions about me or told lies about me that weren't true.
Wow.
And so when she did that, it triggered all of those other times. And it was amazing because when I was going through the brain spotting, you talk about these things that come to your mind, and I started talking about them, and it was this whole line of things, and it was all related. So anyway, then what happens is that, I don't know how it works, but the brain then date stamps it. It changes the date to today. So if you did brain spotting today, it changes the date to today. So it's no longer in the past. It's
That's
gone.
wild. Can you
It
do that
changes
with
it.
animals?
Well, I don't know. Probably. I have no idea. Check it out.
I will go down that road.
Yeah, you could talk to Michelle. Maybe she knows somebody that does that for horses.
Yeah, and in the live feed in the Facebook group, people are saying that they personally have done this for themselves. So if you guys know if it can be done with horses, let me know, you guys. That would be awesome.
That, I mean, I could ask Michelle too if about animals. She's on my website. You can.
Charlene just said that she's done some with a couple dogs for anxiety.
There you go.
Cool.
Great.
Arlene, girl.
No, I did EMDR, not brain
Okay.
spotting.
Oh, thank
Okay.
you. Thank you for
Yeah.
clarifying, but that's
Yeah.
still awesome.
Anyway, that's what she does. And we're having an open house. You're all invited if you want to come on Wednesday. And like I said, it's from 3 to 7. We're going to have tables downstairs and we're doing little raffles and it'll be fun and you can talk to people if you want to. This is a live class that I'm going to be holding in September. I'm going to be in New Jersey. If you want to take a live in-person class, this is going to be live and in person. And before that, so it's going to be the 26th through the 28th in person. The day before, the couple days before, they're asking me to come early and offer iridology consults and offer Zyto, hair analysis, allergy testing, mold testing, all those kinds of things. So I'll be bringing all that stuff with me. And then on September 21st, I'm going to be teaching like the first couple of classes online because that has to do with general information. So if anybody's interested or you know somebody that's interested, I'll be doing that in New Jersey.
Excellent. That's
Yeah.
exciting.
Yeah, we'll see how that goes. And then there's more information on my classes and my bundles. You said that I could put that in here. So
Yeah, absolutely. Do you do remote, Zyto?
I do remote everything.
Oh, cool.
Yeah.
Yeah, but I'm telling you,
Genius,
your photos are amazing.
Genius software. What's Genius software? Trisha said something about Genius software.
Yeah, it's a Genius Insight. It's frequencies, and you
Oh,
scan your picture, it creates your aura, and it reads the frequencies that you need the most, and then you can pick from thousands of them and create your own like repertoire of
Bioresonance.
of the frequencies. Yeah, it's really cool. And you can do animals. You just put your intention in, take their picture, and then go from there.
right. Wow. That sounds really cool. There's all kinds of things.
Hmm?
And
Um,
Julie's asking on Facebook, where in New Jersey again?
oh,
New Jersey
it's at Aura Wellness.
Oral Wellness. Okay.
Aura
Julie, got it.
Wellness. Yeah, and there's the link right there.
Okay.
Let me see if it's 5 Atwood Avenue, Tenafly, New Jersey. There you go, Tenafly.
Excellent. Okay. Any other questions online? You guys pop it in. What town? She's now saying, what town?
Tenafly.
Did
Okay.
you guys see that? I didn't pay attention.
Okay, and then there's that. This is what I do. I do physical iridology, the emotional. I run the Zyto scans. I do the food scans, and I teach both the physical and the emotional iridology. So,
Yeah.
can
Excellent.
you identify spike proteins in the eye? No.
Oh,
No.
wow. What a good question.
Yeah, I used to do live blood, and I was just getting to that. And I know some people can with live blood. Somebody asked to see. Do I still have a few minutes? Because I'll pull up a picture.
Yes, make it fast. I have another account showing up.
Oh, well, I don't have to, but
No, suspense is killing us now.
okay, let me do this because one of your
So live blood analysis, I love. You don't do that anymore?
no, I stopped. I was doing it and I stopped.
I think it's highly underrated, live blood analysis.
Yeah, well, it's too close to diagnostic, and I don't want to, I've always run under the radar. So,
Yeah. Yeah, we had a veterinarian that gave a presentation on live blood. Is that me?
No, this is a client of mine, and this is what a fungus sign can look like. We're not really supposed to call it a parasite, so, but we can call it a fungus sign. And this was 2021 to 2024.
Oh,
And look at it. This is amazing. You see how it comes down here, makes a little, this is a spiral here, and then it comes in here and it does this little gizmo here, and you've got this one coming over here. Look how different it is. See how it comes down here, and then it goes over here, and it goes over here. See how it's moved?
yeah, but it won't go away. It'll just like diminish or
Yeah, well,
fade.
she's hitting it with ivermectin now, so we're hoping it's gonna go away. She's been working on it, and but this is what happens. This is what happens. This is one of the markings that can show up in the sclera, and fungus signs, parasites. That's what it looks like. It's like all squiggly. Looks like
It looks
somebody.
like a worm.
Yeah,
Yeah, absolutely.
yeah.
That's
So yes,
cool.
somebody asked to see a picture of that. So
Cheyenne, did you get that?
I did. Thank you so much because I knew it would be different in sclerology. In the horses, it is the straight lines that look like radial furrows. And what's been awesome is we've taken those, dewormed the horse, taken another picture, they're gone. So it's
mm,
pretty incredible.
yeah,
It's
Same
just
with,
so nice that the iris changes in animals. It's easier than
it's
humans.
so much easier.
So
Yeah,
much.
yeah, yeah.
exactly. Humans are complex.
Oh, aren't we though?
Oh, animals are so easy.
Yeah, and
Yeah,
kids too. Kids are easy. Kids' eyes change. Kids, you give kids some herbs and boom, it's done. Adults, sometimes it takes forever. So, you know,
that's
it's,
amazing. That's
yeah,
so weird, but it makes sense.
does make sense.
Yeah. Brenda, thank you for your time. Hopefully, I'll see you on Wednesday. I have another thing that I have to go to in the morning, so hopefully, I make it out.
All right.
All
All
right.
right. Well, thank you for having me. Thank you for inviting me, and always my pleasure.
Oh, this was so cool. We just
If
really
anybody has any
enjoyed it.
questions, just call me, text me, email me, whatever. I'm
Yeah.
around.
And it was good to see you again after all
Nice
these
to
years.
see you too.